And this morning's Health Watch, your health insurance plan. Consumer Reports magazine analyzed the rankings of more than 800 private Medicare and Medicaid plans. It found a wide range in quality. And joining us now with the details are Nancy Metcalf, Senior Program Editor at Consumer Reports, and Dr. Holly Phillips, Contributing Editor of Prevention Magazine. Good morning to both of you.
Great to be here, Russ.
Okay, let's talk about the survey first. Nancy, is it true that the survey found that some parts of the country actually found better health care than others?
Yeah, weirdly enough, New England, a tiny little part of the country has, you can see, a tiny little bit of states have 18 of the top 50 private plans, which are plans that you would get at a job or buy on your own.
Any reason why that particular area of the country does so well?
Well, the plans just do better on the things that are measured, such as preventive care, care of chronic diseases, and customer satisfaction.
Okay, let's talk about the top ranked plans as we go through these. Are there several companies that keep popping up over and over again?
Actually, there are several companies that don't keep popping up over and over again. Big companies, big brand name companies like the Aetnas, the Cignas, the United Healthcare cover most of the people, but do not cluster near the top of the ranking. So you can't buy by brand name.
Looking at the top 5 right there, any one of those jump out at you?
Well, as you see, this is very much dominated by New England. If you don't live in that part of the country, you've never heard of these plans. They're associated with medical schools, and they're very competitive with each other. So fortunately, and the other thing to talk about here is all of these are nonprofit plans. And going on to the next of the top 10, you see Kaiser there. Kaiser, which is a huge HMO, shows up very high ranking wherever it is.
HMOs or PPOs? I'm finding both on your list there. What scored the best?
By and large, HMOs do better in these rankings than PPOs, but that's not to say that there aren't good PPOs.
I see. Holly, when you take a look at this, anything surprise you about the quality of care?
Well, actually, Nancy had just mentioned, I was surprised that the HMOs scored so high, because we often think of those plans as being very restrictive, where you don't necessarily get to choose your providers or your specialists, but I think the ease of care makes that appealing to patients. You don't have to worry about paperwork, and you have one person really identifying all of your problems and lining out all of your care.
Holly, what do people need to look for when they're looking for a plan?
Well, it really depends on what you need. So you need to pick a plan based on your needs in particular. Now, if you don't mind having one single person organizing all of your care, and you're not worried about being able to go out of network, an HMO would be a very, very good option for you. Now, if you do want to have out-of-network coverage, or you want to be able to see a specialist directly, you should look for a PPO, or what we call a POS. That's a point of service plan.
Gotcha.
And finally, if you never go to the doctor and you know you're not going to use your health care, you might look for a high deductible plan that will lower your premiums, but you have to keep in mind, should you become sick, you really are going to have a big out-of-pocket payment.
You mentioned one way to save money. Any other ways to save money and still get quality health care?
Yeah, I think it's important to see if your employer offers what's called an FSA, a flexible spending account. That's a way where you can set aside tax-free dollars to pay for medical expenses that may not be covered by your insurance. Things like contacts, glasses, even the deductibles on your insurance can be covered by an FSA account. And statistics show most employees don't take advantage of that. So it's something to ask your employer right on, well, I want to say Tuesday.
Right.
Hopefully Monday will be a holiday for most of us.
And it's early this year, right?
Exactly.
Early this year. Nancy, you touched on this a moment ago, but do your findings discover that the sizes of these companies matter when it comes to providing good health care?
Actually, no. Some of our top-rated plans are quite tiny. There's a little tiny one in Western Massachusetts that does a great job.
Okay. Nancy Metcalf and Dr. Holly Phillips, we thank you both.
Thank you.
Great information this morning. Appreciate it.